Depression is a common and serious complication after a stroke. It's largely unrecognized, underdiagnosed, and undertreated. Depression can result from a biochemical change in the brain due to stroke or from an emotional reaction to one. About 30% of stroke survivors develop depression. It can occur right away, or months, or even years after a stroke. Depression may increase with stroke severity, but the processes underlying post-stroke depression are not completely understood. Post-stroke depression, or PSD, is a feeling of hopelessness that interferes with functioning. It's associated with higher death rate, poorer recovery, problems with thinking, such as inability to remember, learn new things, or concentrate, poor functional outcomes, and lower quality of life. Symptoms of post-stroke depression include depressed mood, called anhedonia, persistent sad, anxious, or empty feelings, significant fatigue or lack of energy, lack of motivation, withdrawal from family and friends, problems concentrating or remembering details, difficulty finding enjoyment in anything, sleep disturbances, irritability, an increase or decrease in appetite or change in eating patterns, feeling helplessness, hopelessness, or worthlessness, aches, pains, or digestive problems that don't get better with treatment, suicidal thoughts. Your healthcare professional should evaluate you for depression during a follow-up visit. Several factors can predict whether you're at risk of post-stroke depression. These include a history of depression, physical disability, stroke severity, cognitive impairment, previous stroke, a family history of psychiatric conditions, being a woman, a lack of family and social support after stroke, and anxiety after stroke. Stroke patients present unique challenges in identifying depression. Aphasia or other stroke-related neurological conditions may hinder depression's identification and treatment. There are a variety of screening tools available. It's important to include family members or caregivers in the evaluation process because symptoms of depression might not be easily identified by the stroke survivor. Patient education about stroke and the opportunity to talk about the impact of stroke on people's lives is very important. Because of the complexity of post-stroke depression, several treatments should be tried to determine if they're helpful specifically to you. Post-stroke depression can be treated. Treatments may include antidepressants, which should be closely monitored for their effectiveness. Antidepressants may help people enjoy life again. Psychotherapy, though it is not clear whether psychotherapy alone can help post-stroke depression. Examples of psychotherapy include cognitive behavioral therapy, motivational interviewing, and supportive psychosocial intervention. Patient education, counseling, and social support may all be added as components of a treatment plan. If you've been cleared to exercise, a structured exercise program for at least 4 weeks in addition to other treatment might also help treat your post-stroke depression. Finding a stroke support group can be beneficial. There you can connect with other stroke survivors and share your story. You can also learn of resources and services in your community to help make your post-stroke journey easier. Remember, if you have depression, talk to your healthcare professional. Be open and honest and explain what you're experiencing. Make it clear that what you're going through started after your stroke.